This skill is lower bed back. Wash hands, knock knock. Good morning, my name is Xavier. I'll be your CNA for today. Is it okay if I check your name band? Mary Smith, nice to meet you. How would you like to be addressed? Mrs. Smith? Mrs. Smith, I'm gonna help you with your lower bed back today. Is that okay? All right, so I'll be back with the supplies. I'm gonna wash my hands. I'm gonna grab my supplies. I'm back in the room, so I'm going to wash hands again and close the curtains. I'll adjust the bed to a comfortable position. I'll lower the side rail. And I'll put on my first set of gloves. So Mrs. Smith, I'm gonna ask if you can please raise your leg for me. I'm gonna place a towel vertically underneath their leg. And then just keep them covered. And we only want to expose one area at a time. So you're gonna start with the hips, the upper leg, lower leg, and the last is the foot. So we'll start with the hips. And I have my water, it's 105. I have the patient test it. They say it's fine. I'll make a hand mitt. Water, soap. I'll clean the hips. Rinse. Pat dry. And then the upper leg. So again, make a hand mitt. Water, soap. If you can please raise your leg for me. Rinse. Pat dry. And then I'll move on to the lower leg. And if the water becomes soapy or cold, I will change it. Water, soap. Also check for any skin abnormalities, any redness. Rinse. Pat dry. And then at this point, I'm gonna go ahead and change my water and change my gloves. So this one I'll put into the hamper, and then I have new water, I'll test it, have the patient test it, they say it's fine. And I have a new washcloths as well. So water, soap. I'll clean the foot. Place this into the hamper. And then I'm gonna ask the patient, can you please bend your knee? We're gonna soak the foot for about 3 minutes. 3 minutes has passed, I'm gonna pat dry. And I'll say I'll do the same thing on the other side. So at this point, with the same gloves, I'm gonna remove the towel. Please raise your leg for me. I'll wash my hands. I'll raise the side rail. And I'll lower the bed. So as you're lowering the bed, check for body alignment. Make sure that the bed is locked. And then with my last set of gloves, I'm gonna actually clean up. So dump, rinse and dry. Personal belongings. And this goes into the trash. So I'll wash my hands. Mrs. Smith, here is your call light, your phone, tissue, water, and magazines. If there's anything else you need, just let me know and I'll be back. So I'll open the curtains, I'll wash my hands, step outside, record, and report. If the patient has a rash, you want to make sure to use hypoallergenic soap or mild soap. You know where the rash is and you make sure to notify the nurse about it. You're going to make a hand mitt. You get water, soap, pat the area. Don't rub it because you don't want the rash to spread. Rinse it, and then pat the area. And then at this point, you want to make sure to change the water, change your gloves, and change the washcloth before you proceed to the next part.